Hello, everyone. Welcome to another episode of We're All Patients podcast. Today, I have the privilege of having Bart Darrell on the show, Chancellor of Health Force Kentucky. When we talk about healthcare, we often think hospitals, doctors, and patients, but the reality is much bigger. Healthcare is deeply tied to education, the economy, and the overall well being of our communities. It's not just about treating illness, it's about creating the conditions for people to thrive. Bart Darrell understands this better than most. With a background in both law and higher education, and as former president of Kentucky Wesleyan College, he brings a broad integrated view to one of our most urgent challenges: building a strong, sustainable healthcare workforce. In today's conversation, Bart shares why solving this issue isn't just a job of hospitals or colleges. It requires everyone at the table, from educators to employers to policymakers. True progress depends on breaking down silos and working together. Now, with Health Force Kentucky, Bart is helping lead that charge, connecting the dots between sectors and pushing for collaborative solutions that serve the long game. Bart, thank you so much for joining me.
Well, thank you for having me. Glad to be here.
So, one second here. What exactly is the problem that we're trying to solve?
Well, the problem that we're trying to solve is going to be a long-term. It's a long-term solution to a problem that developed over relatively long term, I think, and will continue to grow. And that is the shortage in the healthcare workforce of all types, from nurses to lab techs to respiratory therapists, even to the general practitioner. It covers the whole spectrum, and it's not a problem that is unique to, say, the urban or larger cities or the rural communities. It's everywhere, and it's not just here. It's a national and international issue.
And what's your goal with helping solve this? Where are you trying to get to?
Well, the goal is the ultimate goal is to have our enough healthcare professionals, quality healthcare professionals, in number and in quality, of course, to meet the demand. Now, but that starts with a sub goal, and the sub goal is to get people, talented people, as young as possible, at least be curious or interested in the healthcare profession. And I'm talking about down to elementary school. You simply can't start too early, in my view, on getting people engaged and interested in healthcare and in the sciences that are associated with it. So there are short-term goals, and then there's the long-term goal, which is to create pipelines, widen the pipelines that exist to get people through the healthcare education and training areas, and also create new pipelines and pathways to meet the demands, the healthcare demands of the public.
So it sounds like you're worried about healthcare losing out on the brightest minds out there.
I'm worried about healthcare all the way around. We are not to be an alarmist, and I don't think that I am. I've never tried to practice law that way or run a college that way, but we are in a crisis situation with healthcare. The baby boomers have come along; they're retiring in large numbers now. The populations are not necessarily there right now to fill that void of not just the people, but the experienced and the people that we've had in healthcare. So we can't wait to attack this problem. And given that I'm in Kentucky, and I know we'll talk more about exactly where our main focus is geographically, but we don't have the luxury of waiting for people in larger communities, let's say larger cities, larger institutions, to come up with a solution for our challenges. We think we have the talent, and we think that we have the passion to tackle it ourselves. And our goal, quite frankly, an auxiliary goal for us is that we hope that and think that we can find a really good solution that maybe we can help others with, and help, go to those communities and put this in place for them too, so that we're not always reinventing the wheel. But we know it can be done.
Speaking of which, so you've said healthcare is larger than health. What does that mean to you?
Uh, Healthcare is larger than just healthcare, and I don't mean to trivialize it, because that's what healthcare is making the people physically better, or psychologically better, and live better lives. But here's the thing, particularly when you get in the rural parts of our country, most of the time, many places, the hospitals or the healthcare providing institutions, they often provide some of the best jobs in a community. They are often the most civically engaged in a community engaged, if you will. So where you have good health care, you also have a higher median wage in a community. You have a more vibrant community, because they're, whether it be in the arts or the schools, those kinds of things that healthcare tends to get involved in from a community development engagement standpoint, you have more of that. So my theory is, Sam, that uh, without access to quality healthcare and quality education, you can hire the most talented economic developers anywhere, and they will fail without those two pillars from which to grow an economy on. So, healthcare is critical to the community in terms of economic development, incomes, culture, even the arts, uh, leisure activities, all of it. So your community, if you, the quickest way to kill a rural area is to do not have access to quality healthcare and quality education. And we think what we're doing in Health Force Kentucky actually contributes to both of those things being stronger.
How did you come to that realization?
Well, I think a part of it for me is being engaged myself civically, and wherever I've been. When I got out of law school and started practicing law in Bowling Green, Kentucky, based out of Bowling Green, Kentucky, which is about an hour south of where I am today in Owensboro, Kentucky. Um, we were all civically engaged at my law firm, and um, I noticed it was impossible not to notice the role that the hospital systems played in those communities. And then my own hometown community of Owensboro, where I am, same thing was true. And then when I found myself in higher education 20 some odd years after I started practicing law and became a college president, uh, I was reminded again of that the hospitals, the clinics, all those, the people involved in those organizations and institutions were involved in what we were doing in education at the higher level. And in my law practice, I also represented school districts across Kentucky. So I saw the level of activity and the commitment to the citizenry from those healthcare folks. And so it's just, quite frankly, it's been in my face for my entire career. And when we see some of the shortages in the healthcare professions, and that is a threat to quality healthcare and the ability of healthcare to participate in communities. I got really concerned, really alarmed. And when I was presented by some people to come and try to create and start Health Force Kentucky, I just felt like it was too important not to get engaged with.
Hmm. So it seems like over time you've seen how central healthcare is to the communities that you've been in.
Yeah,
And Mhm.
yeah, I just think, Sam, you'd be hard pressed to find a thriving community of any size that did not have the quality healthcare and quality education as a big piece of it. I just don't think it's out there.
I mean, that makes a lot of sense. If, let's say, I'm looking to move somewhere, I want to make sure that, especially if I have kids, let's say, that it has a good education system. Also, no matter who I am. I want to make sure that something happens to me, I could go to a place that will make me better.
Yeah. Or maybe most importantly, as we say, people say, well, gosh, where are my kids going to, will they get a good education growing up? And will I have good health care for my kids? Or if my mom comes to live with me in her more advanced years, I'm not going to live somewhere where the things that are not most important to me are not taken care of. I think that's just a human reality for just about everybody.
So, what makes you so passionate about this?
Well, I'm passionate about anything that improves the communities in which I live and am committed to myself. So uh, I'd like to think I would be just as passionate on a global scale if it didn't, have impact on the people that I care about and the places that I love. But that's what's right in my face, and I've I've, I've always tried to operate from a reality, I think, and that is that every single person doesn't just have an opportunity, but has somewhat of an obligation to change the world. And the way that we do that is change the world within our ability to touch and physically touch. And that's your community. So anybody can start anything in any community, no matter how large or how small, in my judgment, can start movements and initiatives that can change the world beyond them. And I just think it's an obligation. And my gosh, if you love people, and I do, then how do you not have a passion for something that is so critical to the welfare of the people around you, even the ones you haven't met?
Wow. Um, so it
And
sounds like you have,
I have to add this.
yeah, please.
I was kind of raised by. I have two brothers and a sister. I have three siblings. We're all about 18 months apart. I'm number two, and we're really raised by a single mom who was a first grade teacher. So we didn't really have much in the way of material things growing up. But I remember as if it were yesterday, every day, how much sleep my mother lost over some of the kids in her first grade classroom every year who were struggling, whether it be economically or with a home life that wasn't ideal, didn't have people that cared about them. And I've always, she's passed away now, but I always marveled at, although her plate was full with four little Darrell kids, and we longed for material things made. We didn't long for love and commitment from her, but she had enough in the tank to love and be committed to kids that struggled and families that struggled outside of ours. And so I think, to be fair about it, I didn't have a choice but to have that view, and my siblings don't either. And I think they could be on here talking about the very same things.
So you're, and especially how your mother, the example that your mother set kind of guided how you see the world.
Yes, without question, and still does daily.
So, with the current shortage of healthcare workers in Kentucky and pretty much anywhere, um, how do you fix that in the short term?
Yeah, well, the short term's obviously the harder problem, and by your question, I know you know that. But on the short term, we have to realize that there are people in workforce now who, with some training, can either change their course quicker, and maybe that are already in the healthcare field but can migrate to healthcare positions that are of critical shortage, or on the entry level position, we can take people. And part of the Health Force Kentucky mission is to help people that want to change what they do. Let's say, for example, this is just one example I can think of many. Let's say that you have that single parent like I had, who is working the 3 to 11 shift at a local convenience store and has 2 children and wants a better way of life. Well, through healthcare, Health Force Kentucky and our education partners and our mobile simulation labs that I'm sure we'll talk about at some point, we can get people trained quicker to maybe it's just as a a phlebotomist or an entry level position in healthcare that gets them on that pathway. But the more shortages, entry level shortages we can shore up now in the short term, that is also helping the long term pipeline and getting people to think more of lifelong learning and lifelong training and lifelong career advancement rather than, oh gosh, I've got this job and I'm gonna stay in it for the next 30 years. I think we've got to abandon that way of thinking globally. And so there's no place like home, as they said in The Wizard of Oz, to start with that mindset. So there are those short-term things that we can do either by retraining or threshold training, as I call it, to get people into healthcare or advance more quickly into healthcare while they're on the job.
And so it seems like you've seen some success with that already.
Yes, we have. We partner with Owensboro Health, which is the hospital system that's based here in Owensboro. And for those who are not familiar with Owensboro, it's a community of around 100,000 in Midwest Kentucky, I would call it. Yeah, they are the second largest employer in the state of Kentucky, west of Louisville. So it's not a small operation, and they have the need for those entry-level positions. We have other hospital systems in the region that have those same needs. So they are all very interested in what we're doing and trying to get some of those people into those positions, and then they will contribute on tuition reimbursement to help grow those folks into other careers. We also partner with 9 post-secondary institutions and 16 counties of school districts in this region to either get people to more advanced levels and the training they offer and give them more opportunities, or get folks started in those pathways.
So as far as staffing and education goes, what are some of the biggest needs in healthcare?
Yeah, well, again, it's all over the board, but the nursing is one everybody talks about a lot, and that has just mushroomed that problem. You'll see a lot of hospitals that have had to resort to traveling nurses. Most people have heard of that. The problem with that is that it drives up cost, because the cost of traveling nurses is typically significantly higher than what you're going to see in the full-time employees. That creates other problems when you have to resort to that, because then you have some culture issues, because you have people that are committed to a hospital, let's say, and they're maybe not doing the same job as somebody who has just come in from another state for a 6-month period, let's say. So there's a lot of incentive in terms of how do we make healthcare more affordable for people by having a more stable and continuous workforce than having to patch it together, despite how talented someone might be who comes in for a while. Even with that, their nurses are overworked. COVID absolutely accelerated this problem that was already coming, and helped push it to a crisis point even faster. We had a lot of nurses, a lot of laboratory technicians, a lot of respiratory therapy techs. A lot of people were driven out of their healthcare, retired early, because of the physical and emotional and psychological stress of dealing with that tragic situation that we all experienced with COVID, and the death and the suffering and the isolation and all that. So it's if I had to pick one area, Sam, I probably wouldn't be able to do it. But we were already seeing some, I'll call them good rays of hope. And I am an optimist by nature. And I see a lot of positive things already starting to happen. I'll give you one example. Um, in our community college system here in Midwest Kentucky, there are 5 community colleges that have the tech programs that I've mentioned already, as well as nursing. Uh, and in the first year of Health Force Kentucky, working with our educational partners, both primary, secondary, and post-secondary, they saw over 17% increase in the applications to their healthcare professional programs. So that was just in 1 year. And our main innovation center that will be
Wow.
built in Owensboro, which we'll talk about, isn't even complete yet.
Well, I mean, that's impressive in 1 year. That's awesome. Wow. So you also mentioned a lot of people kind of burning out during COVID
Yeah.
and shortly afterwards. From your viewpoint, can hospitals do anything to help avoid that fate?
Avoid the burnout.
Avoid, yeah, yeah,
Yeah. And I think most have implemented programs or expanded on them on ones that already existed. I think that the mental health piece uh, for everybody in a healthcare organization is beyond a critical asset. You got to have it. And I think that what we have learned, I think in healthcare and other professions, for goodness sakes, is maybe the earlier signs of that coming, or what kind of workloads and pressures are going to get that ball rolling towards burnout. And I think that if anything good came out of the COVID crisis, it may have been that we're more sensitive to the needs of people. And just because somebody is there every day working very long hours to provide health care for somebody, it doesn't mean they're not still a person, and doesn't mean that they're not affected by what they see and what they have to do. And so I think that we have made great strides generally in understanding the origins and the real triggers for burnout. And think that those programs need to be in place. Those attentions need to be given, regardless of any present environment as it relates to healthcare or disease or pandemic or whatever it might be.
Are there, well, so from your perspective, are you also um, working to encourage, let's say, people from other states or for other regions of Kentucky to encourage them to move to this to this area and help bridge the gap
Yeah,
as well?
well, uh, the answer to that is absolutely yes, and that's one of the reasons that I was so delighted to do your program, because you're not in Kentucky, and you have a good reach. And we have talked to people from everywhere from the state of Washington to the state of Maine. We've had at least conversation with folks about what it is we're trying to do at Health Force Kentucky, which, whenever you want me to, I can get in the weeds on that and what that
Yeah,
really
please.
is. Our primary mandate and our mandate, I say, from the state of Kentucky, because they saw the issue that we're talking about here today and picked our area of Kentucky to try to do this. And they invested $38 million into getting this up and running. This Health Force Kentucky thing, which is really a collaboration of all the folks that I've mentioned and then beyond. So, but yes, I hope that what we're building, that I can help, if we can help somebody in Ohio or California or Texas or Vermont, if we can help them actually do this better than we are, I'll be so excited, because I want to set the bar here in Kentucky and help other people make it even better. We're all in this. We're all in this together. Nobody's immune.
And just so people know what we're talking about here, if you don't mind mentioning kind of uh, a lot of some of the things that Health Force, sorry, Health Force Kentucky does.
Sure. Again, we got started from scratch. I got approached by a gentleman named Mark Marsh, who is the president and CEO of Owensboro Health that I've already mentioned here. And I had known Mark for 25 years. He'd been in some other hospitals where I had practiced law, or, I knew him fairly well. And he had taken over Owensboro Health. And he's one of the people, along with some higher ed folks and maybe a state legislator or two here in Kentucky, that got this idea of what if we really did something different and got education at a large scale, healthcare folks at a large scale, and really created a true collaboration to attack this healthcare professional shortage. And so the first time I heard about it was from Mark Marsh, and he called me and wanted me to come visit him, and I did. And he started explaining this concept that they were going to try to go after and see if the state of Kentucky might invest in it to get it built up. And it sounded so amazing, and I kind of laughed, and I said, "Okay, what do you want me to do?" He said, "I want you to come in and start the build of this." And I said, "Why me?" And he said, "Because you've represented school districts in your law practice forever, so you know all those folks and their languages and the players, and you've been a college president. I was a college president at my undergrad alma mater, Kentucky Wesleyan, for over a half decade, and I also spent some time a while back as on the board of the Kentucky's Council for Post-Secondary Education, which is a volunteer thing. It oversees policy for higher education." So he said, "You know all the players, and you could get this together." And I laughed, and I said, "Well, I tell you what, you get that initial funding, then you call me, because I envisioned something a couple of years away at best." And 2 weeks later, he called me back and said, "Well, we got it, so let's go." And I said, "Oh my, well, okay, let's go do this thing." And I did ask him, I said, "What's your structure right now, this thing?" It doesn't even have a name. And he said, "Well, I'm looking at it." I said, "So you're not a corporation? You're not a nonprofit? You're not?" He said, "No." So we didn't even have a vehicle at that time to even where money could flow through to even do this. So we got started, though, and we built a board of directors of all of our education partners, and got some healthcare professionals, and we started building this thing. And what we've done is we now have about 13, 15 employees. Owensboro Health graciously pretty much donated about 36,000 square feet of a building that we could renovate to create a home base of high-tech healthcare innovation. And that's going to be we'll be in the building by the end of 2025. And we started this, our first year of operation at Health Force Kentucky was really 2023. So we've moved really fast. Knowing that we wouldn't have the structure itself, and understanding something that I will refer to as cultural logistics. And I always tell people when I bring that up, don't Google it. I don't think you'll find anything. It's kind of made up this term. But what that means to me is that in most rural areas, a town might be an hour away, let's say, from Owensboro, Kentucky, where this innovation center will be. But to some people, it is psychologically 3 days by stagecoach. And that's not a criticism. That is a plus, actually, to our region, because the people that live in more rural areas, they want to be there, and they will keep it strong if we give them healthcare and education. They will stay there, and that's what we need, because our larger communities like Louisville, Kentucky, Lexington, Bowling Green, Owensboro, Covington, Kentucky, they're only as strong as our most rural areas. So that's really important. So what we did, we built 2 mobile simulation labs. They're called Health Force 1 and Health Force 2, if you can get
That's right.
the name. Yeah. And they expand to 53 feet by 24 feet. And they have high-tech resources. One of Health Force One even has an immersive room that we can use. We have interactive everything, and we can convert them into a lab, to a nurse's room, to a ER. We can convert anything overnight in just a matter of hours. And we worked with a company called Bruco out of Central City, Kentucky, and they are, I consider, one of the national leaders in this kind of thing now. And so what we are doing is taking high technology education to the people. We need to go where they are. If COVID taught us a lot of things, but if it taught us one thing, we know this: that people got confined and stuck at home. That was bad. But the other flip side of that coin is that people got used to it. And so we've gotten even more interested in demanding of all kinds of services and things being delivered to us. And education is not going to be any different. So we, in our first year of having our mobile laboratories, Health Force One and Health Force Two, we've had over 13,000 individual experiences in the first year of those being in operation. So, what's the long-term impact of that? If we had school children in the fifth grade in there with virtual reality, 3D anatomy, dissecting the human brain in midair without goggles, it reads your eyes and your jawline.
Wow.
Yeah. And so we're getting people excited about the technology and the science of it and the healthcare piece. I really believe this, that with the state of technology today, whether it be in education, business, whatever it might be, but with the state of technology today, if we can't give a fourth grade girl in Cloverport, Kentucky, which is tiny, tiny, tiny here in West Kentucky, a tiny little community, if we can't give her the same opportunities that technology and education and a future and a career as the same people are going to get in Atlanta or LA or even Louisville, Kentucky, shame on all of us, because it's there. I know it's there because we're using it. And so that is a big part of what we're doing. We do not give diplomas or degrees or certificates at Health Force Kentucky. What we're doing is investing in our partners that do this and expanding their ability to reach people, and let the experts do that. Let the experts do what they do best, but at a higher level with more equipment. The other thing that we get to do, Sam, is that, again, we are here to respond to the market demand. We're not here to create the market. I think that's a big mistake for everybody. We want to respond to the needs of the people. So when schools come to us, let's say, for example, Brescia University is one of our higher education partners, along with Western Kentucky University, the University of Louisville, Kentucky Wesleyan, and then 5 Kentucky community colleges. If those folks come to us, like Brescia University did, and said, look, there's not a physician's assistant program in this region, really. We could start one if we had seed money to get this up and going. So they make a proposal to us. We study it, and our board of directors reviewed it and approved it. So we are funding the startup of a PA program right here in West Kentucky. It didn't exist before. And they're accepting their first class this coming year. We've done the same thing with a sonography program that was in the Elizabethtown Community College campus, which is about 2 hours from where I'm sitting right now. To build one of these in Owensboro, at the Owensboro Community College campus, it might take $1 million and 3 years of accreditation. So what we were able to do is fund the ability of Elizabethtown to transport their program in here and create a cohort right here in Owensboro. It's already filling up and starts this year. So what that does, expands the offerings to get people into the healthcare professional pathways, but also we're reducing the cost because they can these 2 campuses now can share in the cost of the professors. And so we're expanding reach and reducing cost. And we think that is the only sensible way to help attack these shortages and give more opportunity to everybody. So what we're doing, and it may sound like I'm rambling a little bit, but I'm giving you the 30,000 feet view of what we're doing. But we are able to get universities and colleges and school districts to truly collaborate together sharing resources, including equipment and human capital, and not see each other as much as competitors, but as allies in this mission that we all have. And that is to serve our communities in a better way and make them healthier and happier and better places to live.
Mm. So, how are hospitals able to, or would you like to see more buy-in from hospitals on this, given that, let's say, rural hospitals, especially,
Yeah.
a lot of times have negative margins they're running on, so they might
Yeah.
not have resources to help.
Yeah. And that's just an incredibly important question you've asked. The answer is, of course, yes. And I'm very, I'm so impressed with the commitment that like Owensboro Health, and as a leader, that's great because other people see what they're doing and they're actually doing this. They give us this building. It's not their program. They're doing this to help everybody. They want
Wow.
other hospitals to benefit as well. So yeah, but what the hospitals do, and increasingly getting in this direction, we're working with some hospitals outside of our region right now to try to be able to present our template to them and help them in their region. But yeah, hospitals are one of the primary beneficiaries of what we do, obviously. Um, they get the product that our schools are going to create together along with us at Health Force Kentucky. They hire these people. That being understood, what you see some of the hospitals do, like Owensboro Health, they're going to invest and help scholarship some of these opportunities because they want those people. They want them to stay with them to make their delivery even better and of higher quality. So, most of these hospitals have programs where you're in school, you can work part-time, and they're also going to help scholarship your education. And so there's every incentive in the world, Sam, for the hospitals and other healthcare organizations and institutions to invest in this because the return on their investment is undeniable. It's just it is, and it's one that's going to continue over time and keep them stable and strong. With other issues going on right now that we haven't even touched on, with a lot of the Medicaid, Medicare issues, and how is that going to be financed in the future? Are there going to be cuts? And if some of the cuts that folks are talking about on the federal level and Medicaid alone, for example, if they actually did them, you would see as many as 35 rural hospitals close in Kentucky as a result, just in
Wow.
Kentucky. And so New Mexico, they project as many as 15 right in New Mexico, the real rural hospitals, because in a lot of these places, you might see the number of their patient base could be as high as 73 to 77% are Medicaid, Medicare. So you can imagine what happened to those smaller hospitals. And if they close in the rural areas, you're going to have people who are 2-3 hours away from healthcare,
Yeah.
particularly in the specialties. And again, back to where I kind of started with this conversation, that is not, that creates an economy and a community that is unsustainable. And no one benefits from that. So we feel like that the mission that we have at Health Force Kentucky, which is a true collaboration with all these other things. We are not a standalone. We are them. We are our education and our healthcare delivery partners, and that's who we are. We feel like we all are in the same situation here, but there is a way. There is a way if we all focus on the import of it all, both financially and geographically, that we can get through this and get healthcare on the best path possible.
So, what are your biggest needs to actually be able to take this to the next level?
I think the biggest needs are the ones that you were very insightful in to touch on, and that is we all have to get on the same page and invest both with our human capital and our financial investments to make these kind of the collaborations like a Health Force Kentucky, make them sustaining, make them part of the infrastructure of our of our country. I mean, I just feel it's the only way to do this. Nobody can do it in a vacuum. But if we all understand that we are connected, whether it be local government, your local schools, your private hospitals, your for-profits, your not-for-profits, your university hospitals, your universities, and community colleges. If we realize we're all connected by this, it's undeniable, and you can't get away from it. You're connected even if you don't want to be. But if we can really get that message out, and so that people understand the true value and the return on this investment, because the return on the investment filters out, as I've said earlier, to every part of your community, that we will flourish in healthcare and otherwise.
So, and we have an audience question from Asim. What can tech companies do to help create the most opportunities for rural community and critical access facilities?
Tremendously important question again. Believe it or not, one of the most important is still just the connectivity at all. There are still many parts of Kentucky that don't have the kind of high level connectivity that some of the services that I've talked about can be provided currently. So I think the first thing that every state ought to be doing, and every community within those states ought to be doing, is a real assessment of where they truly are and their ability to deliver electronically technology to their citizenry. And what I mean by that is, how connected are you relative to what is actually able to, what's capable, what can happen. One of my brothers, Bart Darrell, who spent, I think, a dozen years as the president and CEO of Logitech out in Silicon Valley. I got a lot of this, a lot of thoughts that I have from talking with him. And when we started Health Force Kentucky, we were getting ready to build it. I was talking with him about what I was getting ready to get into. And he said, my goodness, he goes, so much of what you're talking about is gaming technology. And which of course Logitech is heavy into. And he said, a lot of people over the years, it's been, parents and grandparents have wrung their hands, oh, my child or grandchild spending too much time gaming. And he kind of said halfway jokingly, maybe it's a good thing they were, because now they're way ahead. These kids are way ahead of what's here now and how people learn. And one example of that, Sam, is in the immersive rooms that we'll have in our center and that are in the Health Force One mobile laboratory, and I can take a picture of an ER anywhere and upload it into the immersive room, and all of a sudden the immersive room becomes that emergency room.
Wow.
And it's interactive. And so we're teaching people skills, not just how to do something, but where they're going to do it. And my belief is that comfort breeds confidence, and confidence breeds highest performance. So the quicker we can breed comfort, the quicker we build the highest performing employee for the employer. So I think where the tech world comes into this is if they understand the impact that they have and understand how everything they do is ultimately connected to healthcare too, in better communities, then they would see the value in investing in the communities they serve, which is every single one of us. And they have a return on investment. I don't see any of this as either or. In other words, a tech company says, oh my gosh, I can either make a profit over here, or I can be philanthropic and invest in a rural community and give them some technology they don't otherwise have. It's not an either or. Their business grows because everybody's in the market now. And I think that if we truly see ourselves as connected in every single way and stop looking at each other as all trying to take from the same pot rather than pouring into the same pot, which overflows, that we all can gather together, I think we'd be a whole lot better off. But to your specific question about technology, I think if the technology companies, and I think they do, I think many of them do understand how they have become such a critical piece of the healthcare delivery system and the education that gets people there, that the sky is the limit for us as a country when it comes to healthcare, and then ultimately all those other things like economic development and cultural awareness and generally societal growth.
And if tech companies or just companies in general want to reach out and help, how would they do that?
Well, I think that selfishly, I'd say get in touch with us at Health Force Kentucky, because we don't do this right now in Washington State, but we can sure help people there get this started. We can tell them the things we've done and the mistakes we've made that they can benefit from in the process. So I think that, but again, everything starts within your reach. So I think wherever a company is serving, if you go to your healthcare folks, you go to your schools and you say, okay, what do you need to help grow a stronger healthcare delivery, which means stronger healthcare education, which means stronger educational systems. They'll have the answers for you. And our tech companies and our other businesses, they're so talented and have so many really smart people. They'll help figure out a way to invest and help them. It truly has to be collaborative, though. It cannot be done in a vacuum by anyone. That doesn't work and will not work.
So it seems like you were what you're doing here is collaborative, and you're trying to really also spread the word about that, to kind of say, regardless of where you're at, we're all patients, and we're all in this together. And trying to instill really a collaborative mindset uh, with just really the whole population, companies, hospitals, education institutions. And is there anyone that, like, what's the next region you want to kind of get into, or uh, is it all of Kentucky, or?
Yep. Again, we respond to the market demand. The logical extension of what we're doing here would be in Kentucky. If these other regions of Kentucky want it, and our state legislatures, for example, decide, yeah, this is the way to go. We want to become an international or international leader in how we, meet these challenges. So yeah, Kentucky would be the obvious. And we're already talking to a lot of people around the state. We have partners across the state right now who we are on various levels, collaborating with now and making plans with. So we're very excited about those opportunities for the Commonwealth of Kentucky.
Oh. Out of curiosity, I know in our conversation earlier, um, you mentioned that you see hospitals as community centers.
I'm sorry, I didn't hear your last part of your
Yeah.
question.
So when you and I had talked prior, about a week or two ago, you had mentioned that you see hospitals having a greater role in the community than just being, let's say,
Yeah,
hospitals.
yeah.
Could you tell the audience a little bit about that?
Sure. I'll just use Owensboro Health as the example, because that's certainly the one of which I'm most familiar. But Owensboro Health is a not-for-profit hospital system. They have the main hospital is here in Owensboro. Then there is also a hospital in Muhlenberg County, which is very rural, Grayson County, Twin Lakes Hospital over there. And then they have health plexes around the region. And in every region they serve, the community, the county fairs, the community events, the little league teams, the school functions, all those things, you're going to see Owensboro Health involved in it from a volunteer basis with their people, with the resources they've set aside to invest in communities because they recognize the social responsibility of being a hospital or healthcare institution serving a community, that it goes beyond just seeing you when you don't feel well. It's helping you have a good life and a great quality of life in the community. Is that something that should be in the business plan too? Of course it should. Make no mistake about it. It's the hospital is going to have going to do better from a business perspective if people feel good about having a partner in their community. But it's also just part of being a public servant, and that's what I mean. Is there anything more servant oriented than healthcare delivery? I can't imagine what it would be. So I think that what you and I don't think Owensboro Health is totally unique to other places. I mean, most of the time you're going to see the hospitals and the healthcare delivery folks is heavily invested in the daily lives of its citizenry as anyone, if not more. So it's just part of it. And so I guess that's the way I would answer that question. It's not a negotiable. If you want to be in that kind of work or that kind of service, that's just a big part of it. For example, Owensboro Health recently just announced they donated, they had some land that they weren't using, and they donated the land so that 18 homes, Habitat for Humanity homes, can be built in the Owensboro community to help lift up people. That's part of being a civically engaged organization.
Oh yeah, I would say helping build houses is showing their dedication to the community. Well, thank you, Bart. I mean, this has been very interesting. I guess my last question really would be, what would be the best way of people who are interested in learning more or helping the organization or starting similar projects in other parts of the country? What would be the best way for them to reach out to
Yeah.
you?
Yeah. I think obviously you can get on the threshold entry point, I guess, would just go to our website. It's healthforcekentucky.com. You can get on there and kind of check us out. It's also got a directory. Anybody in the world who wants to can call me and reach out to me. I can give everybody my cell number. It's 270-779-4149. You can text me or call me anytime. And all of our folks are that way. We've recruited some of the best and the brightest in healthcare innovation, education, and delivery to Health Force Kentucky. And everybody has the same mindset. You don't come to us without your having a desire and a drive to give it all back somewhere else and help other people. So we're more than ready to share everything we have with anybody who has got the same mission wherever they are.
Well, I appreciate it, Bart. Well, with that, I know we're a little bit over time. So thank you so much again for joining me and giving so much insight to this.
Well, thank you, Sam. It's been an honor. And I want to thank you for your obvious commitment to this whole thing of innovation and healthcare. So it's voices like yours that will help maximize what we can all do together.
I appreciate that. Yeah, I mean, we're all patients, right? So, okay, cool. Well, thank you everyone so much for joining us. And be sure to check out the recording if you want to watch this again. And thanks again, Bart.
Thank you.